whether you are a physician or a surgeon or a gynecologist or a pediatrician. The difference that will be made is between life and death. It doesn't cost much to learn intubation, but it helps a lot. Please do not hesitate to take the opportunity to learn intubation. Because these respiratory failures in neurotoxic cases can be revived even with AMBU bag ventilation. It is not a pathological respiratory failure. It is just a muscle paralysis which can be maintained with AMBU bag even in the remotest of areas. In a place like Kharagpur Divisional Hospital, at least 20 years, even more than that, about 26, 27 years back, I don't know how many of you have seen that vintage Bird's ventilator. Has anybody seen a Bird's ventilator? Bird's ventilator was one which was not user friendly. It worked on a compressed air. There was a compressor outside. How many of you have seen North Block Hospital? Some of you. So it was the compressor had to be placed outside the ward because all compressors, those who have two-wheelers and four-wheelers know when they go to fill up air in their wheels. So it was a similar compressor with a long pipeline, and the Bird's ventilator setting up also takes a little bit of permutation combination. So if a patient could be saved at Kharagpur Divisional Hospital in North Block with a Bird's ventilator because he had a neurotoxin, it can be saved anywhere. Even with AMBU bag you can save a patient. And Kharagpur is an area which even in the Guinness book also mentions about the prevalence of snakes. But don't be too confident because Garden Reach has got its own stock of poisonous snakes. There are certain bungalows I can earmark which harbor snakes. One of them being bungalow number 16.
Dr. Sethi ka sir bathroom mein.
Yes. In front of number 20, number 16, the basement has got a good stock of snakes. The garden, which has been improved by our Mrs. General Manager, was once upon a time a very good stock of snakes. And our BNR Officers Club, Dr. Mukherjee, has replaced the wooden floor. Beneath the wooden floor, you had a couple of cobras staying there. It was their domain basically. So Garden Reach also has its stock of snakes. You should be equipped to tackle snake bites, whether in Garden Reach or anywhere else. And regarding, I think a very important point was raised by Dr. Pal, which Dr. Mollik and Dr. Sethi should take note regarding the availability of anti-snake. It is not a very polite comment about the availability.
Government of India free of cost.
I don't know about Government of India.